Well, there's a thing called brain resilience. In other words, some people who have a lot of brain pathology, like Alzheimer changes, they still are okay. So what is it that they have that protects them? And there's some ideas, maybe education, maybe something else. So that's how neurologists look at it. If you look at a social scientist, they look at it differently. How is it that some children born in a very poor environment do well anyway? They have resilience. And so there isn't a consensus. So we had a very simple one. I said, let's start with the dictionary definition and then work out the specifics for whatever the need is. So we said that resilience is the ability to resist harm, right? Whether it's physical or social or environmental. You know, it's really very simple. And then if you're going to talk about the brain, then the harm will be different. It'll be injury, for example. It'll be something that develops from the genes, or a combination of both. So you can begin defining. So you start with the simple, and then you define it more precisely depending on your purpose. So defining resilience for the public is the dictionary definition. If you're defining it for researchers in, say, the brain, you have to be very precise. And then if you're defining it for some other area, economists, you'll have another definition. But the common denominator is that it's simply the balance between harm and resistance.